Well, it is so good to be with you today. I came to the Shriners Hospital for Children 3 years ago. I was a news anchor in Myrtle Beach, and I really enjoyed my time there, covering different stories and learning the issues that were really important to the community down in the Grand Strand. But I came to the Greenville Shriners Hospital in the Public Relations Department, and now I get to tell the wonderful stories of the kids that we're able to help every day. And I'm able to share the wonderful mission that we're able to accomplish and how we're able to help kids with orthopedic conditions. You may be familiar with the Greenville Shriners Hospital. We are located on the campus of GHS. So they're a wonderful collaborator with us as we treat these kids. But we're specifically an orthopedic hospital, so that is the only thing we do. So that is what we're really, really good at. We see everything from spina bifida, cerebral palsy, scoliosis, leg length discrepancy, club feet, really anything to do with the bones, muscles, and joints. So before we get too far into this, I'd like to start out by letting you hear some of the patients, some of the moms, kind of give you some background about the ways we've been able to change these kids' lives.
I believe we're the premier place that has the capacity, the ability, and the reputation of taking care of children with orthopedic disease.
There's kind of an adage in healthcare, at least I've always used, that if you're going to go get something done, go to somebody who's done it a lot, who's seen it all, who's seen the kind of complications. So I think we have that kind of specialty. Shriners Hospital for Children in Greenville focuses on giving really superior pediatric orthopedic care. We've surrounded that with the expertise of our physicians to offer very specialized and what we call destination programs, or programs that people can't get anywhere else.
It's the best care, and that's what we wanted for our daughter, was the best care. She's not a patient to them, she's a child, and that's huge because they understand how the child's body grows, and everything they have said has been spot on.
The very unique thing about this place is that everything is under one roof. I can get on the phone, call PT, call to clinic, walk down to clinic, talk to the physician. So all of that is very unique, and all of that does make a difference in speed. Things get done a little bit faster.
We love the idea that we can do everything at one place. We don't have to travel all over. Everything is just so welcoming, and they'll care for you and your family while you're here.
To have a child that needs a lot of care is a huge challenge in itself. People are willing to do whatever they can to make it easier for that family.
I looked at my child one time and thought she'll never walk again. When we came to Shriners Hospital for Children, it was just so obvious that this is where, we needed to be for Pam to heal and to walk.
My mom says that what they've done has just changed our lives, and I've felt it too. There's no doubt Shriners made me the person I am today.
I think that, seeing a child from, not being able to walk or needing assistance from their family members to taking independent steps is just fabulous, amazing to see.
We understand the challenges they bring, we measure, we do an analysis, a fairly comprehensive analysis of the data that we collect, and then we sit together as a team and make a determination of recommendations for the families to consider and the patients to consider.
It's really about a team-based approach. It's meeting the social and the emotional and those needs in addition to the medical need. And I think that's what Shriners does so well. They really reach out to the heart of the child.
It's just impressive that everybody seems to know exactly how to approach something and how to make someone feel comfortable. They know how to talk to patients of all different ages, from little kids up until someone my age who was almost 18 when I had the surgery.
Does it make you feel like you're at a hospital? Kind of like a play day when I come here. And you see all these huge animals, and there's usually arts and crafts all over the place. And there's like stickers, and there's a huge water fountain, and it's just a lot of fun when I come here.
Every time we greet Chelsea upstairs, she's smiling faces. This is what we're going to do today. Let's go do it. To him, this isn't a hospital.
My job, it's like instant gratification. These kids just make a difference. You know, you think we're making a difference in their life, but they're the ones making a difference in our lives.
I can leave work and say that was a good day, we did well today. I think we can do that because we've got a good team.
If you have a child and the service is offered here at Shriners Hospital for children, you need to come here. I promise you, you will not find this level of care, knowledge, expertise, comfort, both for your child and for the family, anyplace else.
So I'll just let you hear from somebody else's perspective, someone who has experienced our expert care, you know, what we are all about. We are one of 22 hospitals nationwide as well as Canada and Mexico. So like I mentioned, we are specifically an orthopedic hospital, but there are others who deal with burns, spinal cord injuries, and cleft lip and palate. This is a map of where all those other Shriners hospitals for children are located. So for instance, if a child in this area were to be burned, this hospital doesn't specifically deal with that, so we would help with that collaboration because we're all talking to each other. We've got all these experts, and we can help with, even with the transportation, getting these kids to where they need to be. We have 5 pediatric orthopedic surgeons right now. We're getting ready to hire our 6th. So then we are going to be, you know, one of the largest pediatric orthopedic practices within the Carolinas and maybe even the Southeast. So you're talking about a lot of expertise in one facility. We also have about 60 consulting physicians. We work really closely with GHS to provide that. We use their neurosurgeon and that type of collaborative approach. We're seeing about 14,000 outpatient visits annually. This just to let you know kind of how busy we are. You may have heard back in 2007, 2008 when there was talk of shutting down the hospital. That is no longer the case. We are doing so well with our volumes that it is incredible. That's why we're hiring more and more docs, because we're needing to facilitate these kids and get them in faster, have those wait times even lower so that we can get these kids in and get them help. So we offer a very multidisciplinary approach. You heard one of our staff members talk about everything under one roof and how convenient that is for our families. So in-house, we've got this motion analysis lab, which is a diagnostic tool for us to figure out a child's walking pattern. What's wrong with their gait? We see a lot of cerebral palsy patients go through this motion analysis lab, and it's really very high tech. It's what is used to make the Avatar movies in Hollywood. So, you know, we're talking very high tech equipment that we are able to use to help a child with, okay, is this a case that we need to just monitor? Do we need to try a brace, walk down the hall and get that brace molded? Or do we need to take a surgical measure? So just because a doctor made a recommendation for a child to go through this lab does not mean that it's going to be surgery. We are going to do whatever is best for that child. And so we're really proud to be able to offer this. We have orthotics and prosthetics department where we make our braces and our prosthetic limbs right there in-house. So if something's rubbing, you know, we can get that adjusted. You're talking about kids. We want them to be very active. We have double amputees who are professional surfers in their age category. We want them to be very active in sports and do whatever that they're able to do. So it's very, you know, if this child without an arm wants to play guitar, we're going to make a device specifically for that child. So it's not just we make these types of devices and that's it. It's based on whatever that child needs. We have a physical and occupational therapy department. This is really critical in that you're helping kids when they come out of surgery, as well as we're doing some outpatient physical therapy. Now, because we've got kids that come to us from 6 states, we're not just dealing with kids right here in Greenville. Our PTs and OTs will work with families who live in Virginia, North Carolina, all over the state of South Carolina, Georgia, Alabama, and Tennessee. Okay, this child needs physical therapy at home. So we know people in that area, so we're going to help them out with that. So there's a lot of collaboration to make sure that that child's getting what's needed. We have surgical services department. We have 2 operating rooms. We also have radiology. This is a picture of our EOS machine. We use this a lot for helping with our scoliosis patients because we have to constantly monitor that curvature, make sure that it's not getting worse, seeing if that brace is helping. So this device helps us really help monitor that curvature, and it's 90% less radiation than a typical x-ray. So you're talking about huge health benefits for these kids down the road. We're one of the very few facilities that has this piece of equipment because it does not make economical sense. We're not reimbursed more for this because this is a really, really high-tech, piece of equipment. We're reimbursed the same as a typical x-ray. So in our model at Shriners, we're able to do what's best for the child. Our doctors researched, we need this equipment. We take this to our Shriners and our donors, $850,000 raised in 30 days because we know this is the best for our kids. So that's just something that distinguishes Shriners and our mission really sets us apart. We got Child Life. They're always bringing in the critter keeper, football players to visit with the kids. So we are just really trying to make sure that entire family and the patient gets that excellent care. I'm going to show you some quick before and after videos. These are some of the conditions that we see coming through our doors. Look at this kid. He's not able to rotate his hand fully. So at this point, he was upset that he couldn't play video games. But down the road, he's not going to be able to, extend his hand for a job interview. So we did surgery on him. Look at him now. This was just a few weeks after he got his cast off. So look at the difference. He worked really hard in our occupational therapy department to get that rotation back. This is what scoliosis looks like. We see this in teenagers a lot, but we also see it in infants. We see infantile scoliosis. Now, if they come in early, we can do Risser casting, which is a series of casts. We wrap them in plaster, wrap that spine in plaster. It's like a cast for several weeks, and we have had 30% of our patients be cured from scoliosis, not have to go through that major spine surgery down the road. So we're trying to prevent these major surgeries being done, and again, going back to what's best for the kids. This is Brooklyn. Because she's a teenager, she couldn't go through that Risser casting method, and she did have to have the rods and the screws put in, but about a year after her surgery, she got right back into cheerleading. This is video of a toe walker. Now, this is video that's shot in that motion analysis lab because this is a gait condition. So she looks like she's wearing high heels. That's what a toe walker looks like, and so it's really painful, and she got really tired of walking any distance at all. So look at what we did. We lengthened her hamstrings, and now she's fine. It's a big success for us. This little girl, her feet are turning in, so if she's really trying to hurry to get the swings on the playground, she's most likely going to fall flat on her face. So we were able to do surgery on her. She's a little bit older. You can tell we waited to do surgery on her. We rotated those kneecaps, and now she's fine. This is a very drastic example of what club feet looks like. This teenager came to us from Guatemala, and if she'd been left in her own country without our help, she would have had to go get a job like this, get around like this. It would have been very difficult for her, very, very painful. If we can correct this early in babies, which is often the case because they're here in the U.S., we can do a series of casts, minor surgery, and that child's fine. But in this case, we did have to amputate. And we gave her prosthetics, taught her to walk again. And now she throws a pair of jeans on here in a second. She looks like any other teenager out there. You may remember in the news when we had the Iraqi girl. She came to get her prosthetic legs. So we're able to help. If you hear of someone who really needs our help, from birth to the age of 18, we are available. This little girl's having a hard time getting any type of distance, using those assistive devices, having a tough time. So we gave her a pair of orthotics, and it just made her a lot more stable. It helped her so she's not going to be more likely to fall. So those are just some of the interesting success stories that we see. Wanted to quickly explain to you the packet in front of you has some more information about our motion analysis lab, about our medical staff, as well as there's a referral form in there. So I encourage you to keep that handy so that when when you're dealing with kids, you're on the front lines of helping kids, many of you. If you identify a need, all you have to do is have that family fill that top portion out. If you, as the providing organization, can fill out that bottom half, and we can include you, you'll be part of the authorization so we can keep you in the loop about when that child's coming. And then you can reach out to me If you have a question, I'm not quite sure this is an appropriate referral, you can always give me a call. If I don't know, I have 5 doctors right down the hall from me that I can go ask, and they're very supportive of any type of question like that. So feel free. I would always encourage you to make that referral, even if it's nothing. Even if it's, oh, this child might have scoliosis because the shoulders are uneven, but I'm not sure. We want to be able to give those parents peace of mind. So always make that referral. And we'll be happy to help you out. We've really streamlined that process. You will get a call back within 48 hours of making that referral. So we really want to be able to help get these conditions treated and get these kids the help that's needed. Any quick questions before we wrap up? It is a joy for me to work there. The most frequent comment that I hear is when people walk in the doors, it does not feel like a hospital. It is such a special place. We've really worked hard to make sure that the atmosphere is calming, and that, you know, our staff, our child life department, when the child's afraid and really fearful about the upcoming surgery, we really try to go above and beyond to make sure that that child feels, okay, I'm going to get through this. I have a whole support team with me going to get through this.